To present the next speaker, Mikheil Janiashvili, Ministry of Labor, Health and Social Affairs of Georgia, the eHealth ecosystem. Good afternoon. I will present projects carried out by Ministry of Labor, Health today. Within the project Healthy Citizen, which covers whole health program, which covers over 1,600,000 citizens, and they were provided with various services in provider clinics. Referral surplus program had 31,000. One of the successful projects is hepatitis C elimination program, where over 3,100 patients registered, and we estimate to cover over 5,000. World Bank, USAID, and WHO research proves that Georgian universal healthcare program is positively reflected by 80% of our citizens. And of course we have to mention, we must mention IT's role in our project. We had this in our strategy priorities. We also had modules and tools, and the project related to eHealth histories, which also covers hospital mobile applications. This year we managed to integrate these two big systems of the one platform, and the main with the main point of exchange of financial data, as well as build eHealth ecosystem where participants of this project were able to register. This enabled us to create so-called or build eHealth ecosystem that I am going to talk about. We have three components of this ecosystem. This is electronic tools of a doctor, unified standard, unified platform, and electronic notes of a doctor. So if we proceed chronologically, in 2012 there was a political decision made that the technical task was created in the second phase in 2013-2014. We choose and install the platform for EMR, piloting in the clinics, 50% that covered, and we finished most of this, most part of this project, and building of ecosystem. And the next phase, the first phase, is that the Ministry of Health will not actively participate in this administrative operation, so clinics itself and hospitals itself will be able to create their tools and make the integration, and they will be able to do it within the system. So the system provides for such services.
All the participants who played a role in this, and in the hospital and clinics, doctors, the research, and pharmacies as well. and also where the citizens. In this system, there's one standard. Like with financial data, there's also exchange. And what's most important is, in my opinion, is that the relationship with the doctors, between the government and patients, and the people who participate in these can be better informed, and for the people who analyze this, and in the case of doctors, for example, this is an instrument with which we can make a decision, and if the clinic has a net with which it can exchange information, and if in this presentation is a mobile platform for patients, as doctors, and for administrative specialists, and in all these operational systems is contained within for the smartphones as well, and the user screen, and this application will be free, and this application will begin running in 2016. The user screen will look like this, where the patient will have an ID, and the electronic version, and it will have four menus: the visit history, the doctor's recommendations, and instructions for help. Any diagnosis after visiting a doctor, and will be registered by the doctor, and the patient will have access to this information. And if a citizen needs some kind of service in connection to health, or a psychological condition, they will no longer need to have this written down on paper. It will be in the electronic system now, and the state will help them in doing this. Concerning the patients and the diagnoses, we can also prescriptions made by the doctors, and the receipts will be electronic, and in this application we will be able to have reminders for when they need to take the medicine, at what time, and what dosage they need to take. In addition, there's also other medications that were included on the electronic receipt, and which the pharmacy can implement, and so this is one of the examples that will easily be realized with this electronic application. It has a lot of possibilities, and the relationship between with doctors with patients, between the doctors, and I really like this service, which is, it's not really something significant, but it creates it gives motivation to people, and who can test blood, and submit blood to.
I remember the service that they would inform you that the blood that you turned in that saved one of the patient's life.